Hello, I'm Linda Barlow, Managing Editor of the HealthWell Foundation blog, Real World Healthcare. I'm here with Stephen Weiner, HealthWell Foundation's Board Chair. Thanks so much for joining me today, Steve. Can you tell us about your background and your experience and how they tie into your role as the chair of the HealthWell Foundation Board of Directors?
Thank you, Linda. I'd be happy to do that. I've been involved with the HealthWell Foundation since its inception, and I am by background and profession a healthcare lawyer. I went into healthcare because I believe firmly in putting patients first, which is a core philosophical principle at the foundation as well. And interestingly enough, because of my involvement with healthcare, I've also become quite familiar with the rules and regulations that apply to the healthcare provider world, and where the regulations actually require compliance. That has become kind of the byword of HealthWell.
So I understand there are a number of entities tasked with ensuring compliance within the copay industry. Can you walk us through who those entities are and the various roles that they play?
I'd be happy to. Focusing specifically on the ones that may impact on HealthWell the most, I would name the following. First is the Internal Revenue Service. HealthWell is a charitable organization. It's governed by the rules that the IRS has issued with regard to 501c3 organizations. As a result, it needs to be an independent charity and needs to be pursuing at all times a public mission. It's pursuing the public good. And the IRS rules do require focus on that and continuous attention to the need to maintain that independence. Second would be the Department of Health and Human Services. Because we receive money from pharmaceutical manufacturers and we're facilitating access by patients to pharma products, most of which, if not all of which, are covered by federal healthcare programs, the Department of Health and Human Services plays a critical role in overseeing the integrity of the Medicare and Medicaid program, for example. And we have to be very cognizant of the overall rules under which they function. The third is actually a component of the Department of Health and Human Services. That's the Office of the Inspector General. It sounds like a very kind of scary title. And in fact, in many respects, it probably is. The OIG actually enforces the rules with regard to assuring that there is no waste, fraud, or abuse in the healthcare field. And one of the principal areas in which they have been paying attention has been the relationship between providers and the pharmaceutical manufacturers and charitable patient assistance organizations like HealthWell and our relationship to the manufacturers. And the fourth I would add, in relationship to those previous ones, would be the Department of Justice, which enforces the statutes and regulations that HHS and the Office of Inspector General issue, and has been very actively enforcing compliance requirements in the charitable patient assistance space.
So in terms of the OIG, can you talk in a little bit more detail about exactly how HealthWell complies with their specific legal and regulatory requirements?
Sure, I can give you examples. And again, what I said a few minutes ago is that these rules are pretty prescriptive. The OIG has provided detailed guidance for how to make sure that the operations of a charitable patient assistance program like ours don't fall afoul of the law. And so I will provide, let me give you some examples. In the determination of what funds we have, we make sure that we function independently of the manufacturers and the donors generally. We determine through our own medical advisory group, through our clinicians on our board, through independent mechanisms, what would be an appropriate fund definition. OIG likes broader fund definitions. They don't like us to narrowly define funds. We don't narrowly define funds. We comply with those requirements, but do it with clinical judgment that's independent of the manufacturers. Second example, the OIG has concerns about situations where a particular disease that's being funded by an organization like ours has only one product or has only one manufacturer that produces the products that are used for that disease. Where that happens, we tend to expand, therefore, the scope of what we cover. We will add, for example, in one case, vitamins and supplements. We'll add additional services so that we're not just covering the one product or the products that are being generated by the same manufacturer. We make sure that we have multiple elements of coverage under those circumstances. Another example would be that we cover all of the products that are appropriate for a particular disease that we're funding. And by that, I mean not just brand names, any product that has been FDA approved, any product that is so-called compendia listed. We'll cover biosimilars, we'll cover generics, we'll cover anything that kind of walks and talks, as an appropriate approved method for treating the particular disease. So, and as new products come on the market, we'll include those as well. So we're not beholden to a specific manufacturer. So I think that kind of the breadth we take, the approach of being independent from manufacturers, and our effort to really kind of expand beyond, even just the drug products themselves, are mechanisms that we use for making sure that we're in compliance with the spirit of the requirements as well as the requirements themselves.
It's interesting. Is there anything else that HealthWell does to make sure you're complying with OIG requirements?
Yeah, we do. I mean, we do our processing in a way that also is compliant. It's not just a question of defining funds or determining what products those funds will cover. For example, we approve grants based on a first come, first served basis. We have criteria for approving applicants that are, we think, reasonable, they're verifiable, they're uniform. They are applied consistently. We do not discriminate in any fashion. We don't favor a particular physician prescriber or a particular pharmacy. It truly is, it's a very equitable approach with rules that are very clearly established and identified and followed, so that people understand that, the terms under which they can make the application. It's very much a first come, first serve, non-discriminatory approach. We don't, as another example, we don't identify to the donors who we're prescribing to or who we're providing the funding to. They don't know whether their products are being used or not used by our beneficiaries. We will only give them as much information as we are either required to by law or permitted to by law. But again, part of the underlying concept here is that we don't want a direct line between the donor's funding and the prescription of the donor's products. That's a concern that the OIG has identified as fundamental. And much of what we do is to make sure we break that connection between the two. We don't provide them information other than on an aggregated basis, for example. And then the other thing we do, which is a little bit different, but nonetheless important for this purpose, is we try to broadly publicize the availability of our funds. We don't, for example, leave it to individual physicians to make it known. We certainly don't leave it to the manufacturers to make it known. We have affiliations with a variety of patient advocacy groups, disease-specific advocacy groups. We use social media, we use our real-world blog. We use a variety of mechanisms for making sure that people are aware of what funds we have, what funding we have, and their ability to access our funds.
So it sounds like compliance is really driving everything that HealthWell does. Would you say that's accurate, an accurate statement?
I would say it's very much an accurate statement. From the board on up or down, depending on your perspective, everybody within the organization is focused on compliance in one way or the other on an ongoing basis. One of our board members serves as our chief compliance officer. The board, senior staff, contact center staff, all the staff goes through training annually in compliance. We are continuously updated as to changes that are taking place in the rules that apply to charitable assistance programs like ours. We continuously monitor what the OIG is doing in this field and try to understand not just the specifics of the prescriptive rules, but kind of the underlying intent of what it is they're trying to achieve as a matter of public policy to protect the public in these circumstances. And yes, and I would say that the culture of compliance within the organization is paramount. If we don't maintain that, and we end up in a situation where we are in violation of the rules that apply here, we can jeopardize our ability to provide the good we're providing for our beneficiaries.
Right.
And that's would be a tragedy.
Yes, indeed. Well, thanks, Steve, for sharing all these details about how HealthWell complies with various copay regulations. And I'm glad that you were able to continue to serve your mission to patients. Thanks again.
I appreciate you saying that. Thank you very much, Linda.